handling of chemicals in an effluent treatment plant. General chemicals used in effluent treatment. Let's talk about general chemicals used in effluent treatment. For neutralization or pH correction, we use hydrochloric acid, sodium hydroxide, and lime. Coagulants and settling aids include aluminium sulfate, ferric aluminium sulfate, ferric sulfate, and ferric chloride. These can be used independently or with polyelectrolytes, polymers. For specific ion removal, we use chemicals tailored to the specific chemistry of the treatment. Nutrients like urea and the ammonium phosphate are essential in the treatment process. Disinfectants used include chlorine, bleaching powder, sodium hypochlorite, and ozone. For adsorption and absorption, activated carbon is commonly used. Ion exchange processes depend on the specific ion that needs to be removed. Examples of corrosive substances used in ETEs include sulfuric acid, chromic acid, stannic chloride, ammonium bifluoride, bromine, and ammonium hydroxide. General characteristics of ETP chemicals. Acids and alkalis fall into the category of corrosive chemicals. Corrosives are most commonly acids and alkalis, but many other materials can be severely damaging to living tissue. Corrosives can cause visible destruction or irreversible alterations at the site of contact. Inhalation of the vapor or mist can cause severe bronchial irritation. Corrosives are particularly damaging to the skin and eyes. Certain substances considered non-corrosive in their natural dry state are corrosive when wet, such as when in contact with moist skin or mucous membranes. Examples of these materials are lithium chloride, halogen fluorides, and alkyl iodide. Sulfuric acid is a very strong dehydrating agent and nitric acid is a strong oxidizing agent. Dehydrating agents can cause severe burns to the eyes due to their affinity for water. Use and storage of corrosives. Always store acids separately from bases. Also, store acids in acid storage cabinets away from flammables, since many acids are also strong oxidizers. Do not work with corrosives unless an emergency shower and continuous flow eye wash are available. Add acid to water, but never add water to acid. This is to prevent splashing from the acid due to the generation of excessive heat as the two substances mix. Never store corrosives above eye level. Store on a low shelf or cabinet. It is a good practice to store corrosives in a tray or bucket to contain any leakage. When possible, purchase corrosives in containers that are coated with a protective plastic film that will minimize the danger to personnel if the container is dropped. Store corrosives in a wooden cabinet or one that has a corrosion-resistant lining. Corrosives stored in an ordinary metal cabinet will quickly damage it. If the cabinet supports that hold up the shelves become corroded, the result could be serious. Acids should be stored in acid storage cabinets specially designed to hold them, and nitric acid should be stored in a separate cabinet or compartment. Use and storage of hydrofluoric acid. Hydrofluoric acid is extremely hazardous and deserves special mention. Hydrofluoric acid can cause severe burns, and inhalation of anhydrous hydrogen fluoride can be fatal. Initial skin contact with hydrofluoric acid may not produce any symptoms. Only persons fully trained in the hazards of hydrofluoric acid should use it. Always use hydrofluoric acid in a properly functioning fume hood. Be sure to wear personal protective clothing. If you suspect that you have come in direct contact with hydrofluoric acid, wash the area with water for at least 15 minutes, remove clothing, and then promptly seek medical attention. If hydrogen fluoride vapors are inhaled, move the people immediately to an uncontaminated atmosphere. If safe to do so, keep the person warm, and seek prompt medical attention. Never store hydrofluoric acid in a glass container because it is incompatible with glass. Store hydrofluoric acid separately in an acid storage cabinet and keep only that amount necessary in the lab. Creams for treatment of hydrofluoric acid exposure are commercially available. First aid if chemical exposure. If someone inhales a chemical, the first step is to remove them from the source of contamination if it's safe to do so. Call for medical help immediately. Keep the person warm and calm and do not leave them alone. In case of ingestion, again, remove the person from the source if it's safe. Seek medical attention right away. Keep the person warm and quiet and stay with them until help arrives. For skin contact, remove the person from the contamination source and take them to an emergency shower or any available water source immediately. Quickly remove clothing, shoes, socks, and jewelry from affected areas, cutting them off if necessary. Be careful not to get the chemical on yourself or inhale vapors. Flush the affected skin with water for at least 15 minutes and seek medical attention promptly. If a chemical gets into someone's eyes, rinse the eyes with water for a minimum of 15 minutes. Avoid getting the chemical on yourself or inhaling vapors and get medical help immediately. Personal protective equipment. When working with chemicals, always wear the appropriate personal protective equipment. Use neoprene, rubber, or PVC gloves to protect against acids and bases. Wear a rubber-coated apron for body protection. Always use goggles to protect your eyes, and if splashing is likely, wear a face shield over the goggles. Handle corrosive substances in a chemical fume hood to avoid inhaling harmful vapors. Following these first aid steps and using proper PP can significantly reduce the risk of injury when exposed to chemicals. Always prioritize safety and seek medical attention immediately in case of exposure.
This is all about today's topic. Thanks for watching Funny EHS Info. And don't forget to subscribe our channel to get immediate notification of our videos. Share our videos to your friends and colleagues to create safety awareness. If you have any questions and requirements, please comment in comment box.